Assalamu alaikum. Today we will discuss esophagus. Esophagus is the narrowest part of the digestive tract. Esophagus, extension, it extends from the pharynx up to the stomach. Then part of the esophagus, cervical part, thoracic part and abdominal part. The total length of the esophagus is 25 cm. Within this, the cervical part is 4 cm, the thoracic part is 20 cm and the abdominal part is 1 to 2 cm or 1.25 cm. The cervical part extends from the cricoid cartilage at the level of the cervical 6 vertebra up to the upper border of the manubrium sterni. Then the thoracic part. Thoracic part extends from the upper border of the manubrium sterni up to the esophageal opening of the diaphragm. Then the abdominal part. It extends from the esophageal opening of the diaphragm up to the cardiac orifice of stomach. Now the course of the esophagus. Esophagus, it begins at the neck level. At the lower border of the cricoid cartilage, vertebral level is the cervical 6 vertebra. Then it descends in front of the vertebral column and passes through the superior and the posterior mediastinum. Then it pierces the diaphragm at the level of the thoracic 10 vertebra and then it ends at the stomach at the level of the thoracic 11 vertebra. Now the curvature. In the esophagus there are two curvature. There are two side-to-side curvature and two anterior-posterior curvature. Anterior-posterior curvature, it corresponds the cervical and thoracic curvature of the vertebral column, and the lateral curvature, that the esophagus deviate twice in the left side, okay, and remain in the median plane at the level of the C6 and thoracic 5 to thoracic 7 vertebral level. So we can say there are two types curvature, anterior-posterior curvature and the lateral curvature. Anterior-posterior curvature correspond to the cervical and thoracic curvature of the vertebral column, and the lateral curvature, it deviate two times at the left side and remain in the median plane at the level of the C6, that is at its commencement, and opposite to the thoracic 5 to thoracic 7 vertebral level. Now the constriction of the esophagus. Esophagus is constricted four sides at its commencement. It is constricted by the cricopharyngeus muscle. Then at the level of the arch of aorta, this constriction is known as aortic constriction. Then it is constricted by the left principal bronchus. It is known as the bronchial constriction. And the fourth constriction, when it passes through the esophageal opening of the diaphragm, that is known as the diaphragmatic constriction. In the lateral view, we can see here, it is constricted by the cricopharyngeus muscle, and then the esophagus is constricted by the arch of aorta. Then it constricted by the left principal bronchus, and then the last constriction, which is produced when it passes through the esophageal opening of the diaphragm. This one is the diaphragm. Okay. This constriction distance from the upper incisor teeth. The cricopharyngeus constriction is situated 6 inch distance from the upper incisor teeth, and the aortic constriction is situated 9 inch from the incisor teeth, and the bronchial constriction to 11 inch, and the esophageal constriction is 15 inch. We can easily remember it by multiply the 3 by 2, that is 6, then 3, that is 9, then 4, that is 12. We can remember it by 11, and 3 into 5 by 15 inch. Okay, so the first constriction situated 6 inch distance from the incisor teeth, then the second one 9 inch, then third one 11 inch, and the fourth one is the 15 inch from the incisor teeth. Then we have to know the vertebral level. We know the cricoid cartilage situated at the level of the cervical 6 vertebra, and the aorta, we know the arch of aorta situated at the sternal angle, and which vertebral level is the thoracic 4. So the aortic constriction produced at the level of the thoracic 4, and the bronchial constriction situated at the level of the thoracic 6 vertebra, and the esophageal opening, when the esophagus passes through the diaphragm, it is situated at the level of the thoracic 10 vertebra. So you can follow this box from Vishram Singh. It's very important for your written question. Now relation of the esophagus. In the cervical part, in front there it is related with the trachea. Okay, in front it is related with trachea, and behind there is situated cervical vertebra. On each side there is presence of the common carotid artery. On the right side, right common carotid artery, which is the branch of brachiocephalic trunk, and on the left side, left common carotid artery, okay, which is the direct branch of the arch of aorta. Now in the thoracic part. In the thoracic part, in front it is related with the trachea, again trachea and arch of aorta, then left principal bronchus, and here the heart is present. Heart is removed from here, so here presence of the fibrous pericardium, and posterior sloping of the diaphragm. Here the diaphragm, so anteriorly it is related with the posterior sloping of the diaphragm. Okay, Now in behind there is situated here, as it is situated in the thoracic region, so behind there is thoracic vertebra. And right posterior intercostal artery, here there is a presence of intercostal artery, right posterior intercostal artery. Aesophagus vein is also situated in the posterior aspect, and hemiacegus vein, and we can also say the descending thoracic aorta. So again, posterior aspect in the thoracic part, posteriorly it is related with the thoracic vertebra. Then right posterior intercostal artery, it is a thoracic duct, and aesophagus vein and hemiacegus vein and hemiacegus vein, and descending thoracic aorta. Okay, and on the right side, in the thoracic part, on the right side, it is related with the right lung. Here we can see on the right side, it is related with the right lung. And there is a presence of the aesophagus vein also on the right side. Here on the right side there is also presence of aesophagus vein. Okay, and the right vagus nerve also, if we can see here, the right vagus nerve, this one is the vagus nerve, the yellow color structure, this is right vagus nerve. And on the left side, this one is the left vagus nerve. So we can say in the left side it is related with the left vagus nerve and the recurrent laryngeal nerve. Okay, this one is the recurrent laryngeal nerve. Close view, this one is the recurrent laryngeal nerve, this one is the left, and this one is the right recurrent laryngeal nerve. So these are not so much important, you can read from your book. Oh, I skip the clinical significance of esophageal constriction. These constricted site, these are the, as they are constricted part, so the foreign body may lodges here or stuck here. After taking corrosive substance, this part stricture may develop in this part, and predilection for carcinoma of the esophagus may occur here. And when we introduce gastric tube, it may difficult to pass. Here we can say we introduce a gastric tube, and it is difficult to pass near the site of constriction. Now artery supply, the cervical part is supplied by inferior thyroid artery, and the thoracic part is supplied by the descending thoracic aorta and bronchial artery, and both are the esophageal branches. And the abdominal part is supplied by the left gastric artery and inferior phrenic artery. Here we can see this is the esophageal branches of inferior thyroid artery. This is inferior thyroid artery, which is the branch of thyrocervical trunk, and thyrocervical trunk is the branch of subclavian artery. Okay, and so we can say the cervical part is supplied by the inferior thyroid artery. Now the thoracic part is supplied by the esophageal branches of descending thoracic aorta, as well as the bronchial artery. Okay, here esophageal branches of the bronchial artery, we can easily remember here bronchus present, so the thoracic part is supplied by the esophageal branches of the bronchial artery and esophageal branches of the descending thoracic aorta. And now come to the abdominal part, this portion, and as it is situated beneath the diaphragm, the Latin term of the diaphragm is the phrenic, so it is supplied by the inferior phrenic artery, which is the lateral branch of the abdominal aorta. This is the abdominal aorta, and also supplied by the esophageal branches of the left gastric artery here. And the esophageal branches of the left gastric artery, it is the branch of celiac trunk, which is the ventral branch of abdominal aorta. We can easily remember it is situated beneath the diaphragm, so inferior phrenic, and it is aimed at the stoma, so left gastric. Now the venous drainage, we can see the cervical part. The cervical part is drained by inferior thyroid vein, okay, which ultimately drain into the superior vena cava. And the thoracic part is drained via the aesophagus vein and hemiacegus vein. Now come to the abdominal part. This is belong to two system. It is drained by vein of two system. Here we can say the dark blue color and light blue color. This light blue color belongs to the portal system, and the dark blue color is belongs to the caval system, that is inferior vena cava. If you notice that the lower end of the esophagus, that is abdominal part of the esophagus, here we can see this is inferior phrenic vein, which belongs to the caval system, that is inferior vena cava, and this is vein, this is left gastric vein, esophageal branches of left gastric vein, which belongs to the portal system. So we can say it is here there is a communication between two systems, that is known as the portocaval anastomosis. This portocaval anastomosis has clinical significance if portal hypertension developed due to cirrhosis of liver, that is carcinoma of the liver. This portal vein cannot drain, so this vein become tortuous, elongated and dilated. This tortuous, elongated and dilated portal vein is known as the esophageal varices, and it produces at the lower end of the esophagus. Okay. If this vein is ruptured, blood may comes out with the vomitus. This is known as the hematemesis.